She's having an allergic reaction to the gadolinium. She should be dead in 2
Oh,
minutes.
that's what it was. Oh, yeah.
Yeah.
She needs an EpiPen. Is that what you would do for that? Epinephrine?
You would do epi for this. And this is about the worst place to have an anaphylactic reaction. What's up, YouTube? Welcome back tonight. We are taking on a brand new show.
House.
Beat me to it. We're watching House.
Right.
The pilot episode. For those of you who may be new to the channel, I am Dr. Todd.
I'm Allycia.
And I'm an internal medicine doctor.
I am not.
Although I work in the outpatient world now, but I did train internal medicine. That's the only thing I really know about House is that he is, I believe, an internist. Yes, which...
He deals with zebras.
That's what I think. So the joke in medical school is everything's lupus.
About House?
Yeah. But,
okay.
But I don't know anything about, well, let's see, when was... Yeah, so I would have been in medical school when this was on. I think. I really don't know when it came out.
Okay.
So all I really know about House is that, in that he is apparently a little bit abrasive and apparently everybody lies or something like that.
Okay.
That's what I've been told. Yeah. We're going to jump in to find out what that means.
Yeah.
But I'm excited to get into it. Obviously, being an internal medicine doctor, this could be, or should be, I think, right up our alley. We just got done watching The Pit Season 2. If you haven't seen it, go check it out. We're adding this into our arsenal of shows along with ER and some many others. Mainly because I've never seen any medical shows, and we're using this opportunity to...
I watch all the shows,
And
but
I
I
watch it not.
typically don't watch medical shows.
Yeah.
So this has been new for both of us.
This has been an adventure. So
Yeah.
anyway, please consider, if you haven't already, hit that subscribe button. Help us keep growing. Like, comment, all the things. Tell us what your favorite episodes of House are. And if there's anything else you guys would like to see us check out, we are happy to take suggestions, recommendations, all the above. All right.
Let's get it.
You ready?
Yeah.
I'm ready. All right. Subscribe.
Kind of start out like goosebumps. Bring me back to my childhood.
We'll see if it's like Goosebumps.
Oh, what is she from?
House?
No, she's from other things.
I've never seen her before.
You haven't?
I don't think so.
I'll have to look it up when we're done.
Subscribe.
Kind of start out like goosebumps. Bring me back to my childhood.
We'll see if it's like Goosebumps.
Oh, what is she from?
House?
No, she's from other things.
I've never seen her before.
You haven't?
I don't think so.
I'll have to look it up when we're done.
She one of the like residents, you think?
I don't know. She got like an old doctor bag. Well, a file bag, I guess.
It's like a briefcase. She's like, you're running late.
I'm always right on time. Thank you.
Why are you late?
You're not gonna like the answer.
I already know the answer.
I missed the boss.
I don't
Oh, I could teach her?
Oh, okay.
At the night, the alarm didn't work, or maybe it did.
I didn't sleep with him.
There's something either very wrong with you, or there's something very wrong with him.
It's going to drive me crazy because she's very familiar.
Why don't you tell us what you did this weekend?
How come you always have to tell what we did and you don't tell us what you did?
Fair. Kids are so honest.
Yeah.
I made a new friend. So much fun to make new friends, isn't it?
Yeah. Did you tell your mom and dad about your new friend?
You
Ask
should
them the big
never
questions.
keep anything from your parents. And I told mine,
What was that?
You have Tourette's?
Or speech?
Or a stroke?
Maybe. Okay.
She already helped.
Stop.
So she's able to write.
Nurse.
Call the nurse.
Oh, she having like a seizure?
Maybe.
Okay.
Okay. Yeah, it looks like she's posturing, as we would say. All right.
All right. You ready to guess the diagnosis?
We'll see. You know, I may, if we get into this like intro here, I may jump in real quick. So yeah, I mean, look, first thoughts are somebody has difficulty formulating words. The suspicion should be immediately very high because really dangerous things can do that. Now, seizures.
Suspicion for what?
Well, I mean, so stroke would be probably the highest on the list
okay.
because, you know, what we call dysarthria, the inability to speak, that's actually one of the cardinal features that we would see in a stroke. So that should raise suspicions very quickly. You can have other conditions do this. So, and I suspect House is going to walk us through some of the diagnostic, we'll say, framework that we would use in medicine, but that would be high on my list. So seizure, since we saw some posturing there, but you can have posturing from other things. So you could have, like, say, a syncope, which is loss of consciousness. That syncope could be from a non-seizure and you could still posture.
Okay.
But seizures on the list as well, obviously, based on that movement. And then, of course, things like, I mean, technically like a migraine, like a complex migraine could cause some speech issues, although you probably wouldn't lose consciousness.
Yeah.
Kind of looks like she did. So anyway, we will see as we get a little deeper into this, but I'm already intrigued.
Yeah, me too.
29-year-old female, First seizure 1 month ago, lost the ability to speak.
They all assume that I'm impatient because of this king.
Put on a white coat like the rest of us.
I don't want him to think I'm a doctor.
I don't wear my white coat either.
That's fair enough. I don't like healthy patients.
Wait, what?
He likes the complicated cases, I'm assuming.
I suppose.
She's my cousin.
Your cousin doesn't like the diagnosis. I wouldn't either. Brain tumor. She's gonna die. Boring.
Oh, gosh. He is abrasive.
Yeah.
You don't need to actually know anything to figure out what's wrong.
You're the oncologist. I'm just a lowly infectious disease guy.
Oh, so he's infectious
Infectious
disease.
disease. Interesting. To bring Peter on here.
I know.
Dr. Tran, my best friend's an infectious disease doc.
And she's not responding to radiation treatment.
None of which is even close to dispositive. All it does is raise one question. Your cousin goes to an HMO?
Wonder what medication he was taking.
I don't know. Well, he's got like a lump.
Yeah.
Okay. Interesting camera angle.
Yeah. We're going to dive into the body.
Okay.
It's like that kids show on the Magic School Bus or whatever. You go like, did they do that?
On the Magic School
Or
Bus?
something like that? Then isn't there a bus that could go into the body?
The bus? Oh, well, the bus could shrink and go anywhere.
Look at all those red blood cells. Shout out cells at work.
It's a lesion.
Yeah.
Big green thing in the middle of the bigger blue thing on a map is an island.
Shouldn't we be speaking to the patient before we start diagnosing?
Is she a doctor?
No, but
Everybody lies.
That's the line you were talking about.
He said
isn't treating patients why we became doctors?
No, treating illnesses is why we became doctors. Treating patients is what makes most doctors miserable.
Okay.
Okay. Him and Dr. Robbie seemed like you'd be good.
Humanity is overrated. I don't think it's a tumor.
First year medical school, if you hear hoofbeats, you think horses, not zebras.
Are you in first year medical school?
You've said that many times.
First of all, there's nothing on the CAT scan. Second of all, if this is a horse, then her kindly family doctor in Trenton makes the obvious diagnosis and it never gets near this office.
Generally speaking, probably.
Differential diagnosis, people. If it's not a tumor, what are the suspects? Why couldn't she talk?
Aneurysm, stroke, or some other ischemic syndrome.
But you would have seen that on MRI
Crutchfield-Jacob disease?
That cow. Zebra.
Wernicke's encephalopathy.
if she was alcoholic.
Assume it's a corollary of people lie that people screw up.
Redraw the blood tests and get her scheduled for that contrast MRI ASAP. Let's find out what kind of zebra we're treating here.
You'd like to think they might have had one already.
Yeah.
And so, yeah, kind of jump in again real quick. So, like, part of what you're doing here is, again, going through that diagnostic framework to see, because when you have a seizure, you're trying to determine, is this seizure provoked or unprovoked? And a provoked seizure would be that the seizure was a consequence of something else. And so, like, some kind of toxicology, right? So poison or medication induced or something like that. Or could it have been provoked by a brain tumor, which they're talking about? Or could it have been provoked by an infection? So common, meningitis or something like that, or other types of infections could do it. Metabolic issues could do it. So like low sodium can induce a seizure. Alcohol withdrawal could induce a seizure. So these are all, like, as you're going through all the different potential causes, you're trying to determine provoked versus unprovoked. Because if it's unprovoked, then that's where you start getting into the realm of epilepsy. And so, like, by definition, epilepsy would be 2 unprovoked seizures.
Okay.
And then you would treat that with anti-epileptic medications if you had 2 unprovoked seizures, or 1 unprovoked with like risk factor, like severe risk factors. So let's say imaging findings that might suggest this is a high risk patient.
Yeah.
So that's what he's going through. That's what they're trying to figure out here. We'll see. We haven't really had any insights, but I guess the only thing I would say is, I mean, going back to that, his comment, like, we went into medicine to treat illness, not to treat patients. I disagree with that. Like, on a fundamental level, that doesn't mean patients don't sometimes lie. I mean, I don't disagree with that, but interesting take.
Yeah.
We'll see.
Well, if he's infectious disease, could it be an infectious disease?
Yeah, it definitely could be.
Like some parasite up in her brain or something?
Could be. That would be a zebra.
I can still fire you if you're not doing your job.
I'm here from 9 to 5.
Your billings are practically non-existent.
We're here.
You ignore requests for consults.
I call back. Sometimes I miss dial.
Jeez.
6 years times 3 weeks. You owe me better than 4 months.
The clock. I'm going home.
To what?
Nice.
He's probably got a cat or something.
Yeah.
A point of agreement. You're not going to fire me.
Your reputation won't last if you don't do your job. Clinic is part of your job.
As the philosopher Jagger once said, you can't always get what you want.
But if you try sometimes,
Yeah. Just might find.
get what you need.
You're not my doctor. Are you Dr. House?
Thankfully, now I'm Dr. Chase.
Thankfully, no.
We inject gadolinium into a vein, distributes itself throughout your brain, and acts as a contrast material for the magnetic resonance imager.
Basically, whatever's in your head lights up like a Christmas tree.
Might make you feel a little lightheaded.
Dr. Cameron.
You have to avoid gadolinium in patients with advanced renal failure.
Okay.
But that's...
You pulled my authorization.
What?
You're risking a patient's life.
I assume those are two separate points.
You embarrass me, and as long as I work here, you have
Is
no
the yelling
legal...
designed to scare me? Because I'm not sure what it is I'm supposed to be scared of.
I think he's frustrated.
Well, yeah, if you can't treat his patient appropriately.
You can't always get what you want, but as it turns out, if you try sometimes, you get what you need.
You're not letting me treat patients.
I need you to do your job.
This is a very complicated dynamic here.
Well, she's saying the whole job.
Okay.
Right? Like,
not the parts you want to do.
there are parts of our job that we dread.
I've got to do 4 hours a week in this clinic until I make up the time I've missed. 2054. We caught up in 2054.
Oh, wow.
Oh my gosh.
Better love this cousin a whole lot.
That's the only way he's going to get. Oh, that's kind of like.
Yeah.
Oh, she's like basically blackmailing. I mean, manipulating him. Well, black form's a form of manipulation, right? Black form? Did I say black? Whatever.
You ever had an MRI?
Yes.
I have not.
Yeah, I fell asleep. It was after we had our first kid, and I hadn't had much sleep.
Yeah, there's lots of loud banging in these.
I don't feel so
I don't know why they.
It's all right. Just try to relax.
Oh, she be sick. Oh, that's weird.
Oh, is she having a seizure or having an event?
Yeah, but it's almost like is there something reacting with the MRI?
I would.
Oh, her throat's closing. Like can't breathe.
Fell asleep. She's exhausted.
She was claustrophobic 30 seconds ago. She's not sleeping. We gotta get her out of there. She's having an allergic reaction to the gadolinium. She'll be dead in 2 minutes.
Oh, that's what it was. Oh, yeah.
Yeah.
She needs an EpiPen. Is that what you would do for that? Epinephrine?
You would do epi for this because this looks anaphylactic. And this is about the worst place to have an anaphylactic reaction.
Yeah. Freaking heck.
So I've never had to do one of these.
Yeah. It's a trach or a crike? Like crikey?
No, not quite.
Good call.
It was interesting because they were all very quiet and calm.
Yeah, it was less maybe dramatic than it probably would have really been.
Yeah.
Although cutting someone's neck's pretty dramatic.
Yeah. Usually I'm just watching the pit and stuff. Like it's loud.
Yeah.
So, like,
We need to know if there's some genetic or environmental cause that's triggering an inflammatory response.
I thought everybody lied.
Truth begins in lies. Think about it.
okay.
Versions of the truth, I guess.
Yeah.
12:52 p.m. Dr. House checks in. Please write that down. You have cable TV here somewhere? General Hospital starts in 8 minutes.
General Hospital.
Okay, I did watch General Hospital.
Should we react to that one?
Oh God, no, there's so many seasons.
Dr. Dre.
Funny color.
Patient admitted complaining of back spasms.
I think I read about something like that in the New England
Patient
Journal
is
of Medicine.
orange.
Color?
No, the fruit.
I mean yellow. It's jaundice.
I mean orange.
Orange. The keratonemia.
Oh. Eating too many carrots?
Well, foods that are rich in keratin could.
Next morning, I could barely stand up. Like smiling, so I take it that means this isn't serious.
Painkillers.
For you, for your leg.
No, because they're yummy.
Yeah.
I was wondering if
She's sharing
Oh
pills.
God.
You have a deeper problem. Your wife is having an affair.
What?
They're orange, you moron. One thing for you not to notice, but if your wife hasn't picked up on the fact that her husband has changed colors, she's just not paying attention. You consume just a ridiculous amount of carrots and megadose vitamins. Carrots turn you yellow, the niacin turns you red. Find some figure paint and do the math and get a good lawyer.
Okay. All right. Because his wife had noticed he turned orange. She's cheating on him.
Yeah, that's a bit of a leap.
Yeah.
Has he been using his inhaler?
Not in the past few days. I worry about children taking such strong medicine so frequently.
What happened to your leg?
Your doctor probably was concerned about the strength of the medicine, too. She probably weighed that danger against the danger of not breathing. Oxygen is so important during those prepubescent years, don't you think? A stimulant triggers cells in your child's airways to release substances that inflame the air passages and cause them to contract. Mucus production increases, cell lining starts to shed. Steroids
He's wheezing.
stop the inflammation. More often this happens.
What?
Oh, she's got something.
Forget it. If you don't trust steroids, you shouldn't trust doctors.
Wait, what?
I think that
Had a-
lady, yeah.
Yeah, had another
An
thought.
epiphany.
Yeah, but treat the kid.
I know.
Yeah, I think maybe, again, like a brief jump in there. So, patient interactions, it's not uncommon to have a patient who will say has this opinion that is very anti sort of medication. This lady didn't seem like,
I know.
She wasn't like aggressively denying the need. Like she's just saying, hey, I worry about too much medication in a developing child, which I think you can reasonably share a concern like that. I do think it's important to have those conversations though. And so yes, the weighing the risks and benefits of medication use, obviously when the risks are not being able to breathe, then I think it's fair to say, I don't know that the approach is quite how I would do it.
Yeah.
And the reason I say that is because, and I know this is, I know it's a show, so I'm not trying to critique every little detail of, Hollywood. But I will say, as we look at this, there's data to support this. A doctor's approach can make a big difference in how much the patient actually will say takes in of what they have to say, and their what we might refer to as their adherence to the management plan. And so, it may sound silly, but you'll hear stories or read stories about patients who didn't take a medicine because they didn't like the doctor that prescribed it.
Yeah.
Right.
So then maybe they didn't trust it.
Right. And so the medication may have had great use. It may have helped them. It may have prolonged their life, frankly. But they didn't like the doctor that prescribed it. They didn't maybe understand why it was prescribed and then decided not to take it. So we'll hear stories like that. So anyway, interesting. We'll see.
Yeah.
Let's see where this goes. But something about steroids. So I'm assuming he's maybe going to try some steroids on her to reduce swelling or
anti-inflammatory.
brain swelling.
Give her steroids. High doses of prednisone.
She's in the presence of Dr. House.
That wasn't. Remember she talked about a new guy, what you think it was House?
Doubt it.
It's a tumor. Her SED rate is elevated. Mildly.
It could mean anything or nothing.
So SED rate, ESR, that's an inflammatory marker.
It's vasculitis, except that it could be. Blood vessels are inflamed. That's going to look exactly like what we saw in the MRI from Trenton County. The pressure's going to cause neurological symptoms.
You can't diagnose that without a biopsy.
Yes, we can. She gets better, we know we're right.
Mm-hmm.
We learned something else.
What's that?
That's not
That you're
that.
wrong. Okay.
So maybe thinks it's what's called giant cell arteritis, which is a disease of the major blood vessel to the eye.
Oh, okay.
I said you're stopping my radiation.
We're just trying some alternative medication. Where's your family from then?
Steroids aren't an alternative to radiation.
The tests weren't really conclusive.
We're treating you for vasculitis. It's the inflammation of blood vessels in the brain.
But it's not a tumor. I don't have a tumor.
I guess you can't really say that definitively, right?
Well, I guess I may have kind of missed some of this, but I know they're maybe trying to get an MRI. An MRI would have answered the question.
Yeah, but they couldn't because she had.
I know, but they had an MRI from an outside facility that I guess they don't trust.
No, he just wanted one with the contrast.
With contrast, yes.
I was smelling the floor. Do you have any pets in this class?
No, but we used to have a gerbil, but Carliel dropped a book on it.
So I could say I've never gone to a person's employment
To investigate.
to investigate for.
Yeah.
Interesting.
You said you didn't have any pets in this class.
Parrot is a bird.
They're a hospital. It's Sonny and Jason.
How many kids were in the class?
20.
How many are homesick?
None, but
None. But you figured that 5-year-olds are more serious about bird hygiene than their teacher.
Yeah, it's fair.
she lives in Trenton. I can go up to her room tomorrow morning, ask her for the key.
Would the police call for permission before dropping by to check out her crime scene?
It's not a crime scene.
As far as I know, she's running a meth lab out of her basement.
She's a kindergarten.
I'll give you a for instance. The lady back there who made your egg salad sandwich. Her eyes look glassy. Did you notice that? Now, hospital policy is to stay home if you're sick. And the sign in the bathroom says that employees must wash after using the facilities, but I figured that somebody wipes snot on a sleeve isn't hyper concerned about sanitary conditions. I want you to check the patient's home for contaminants, garbage, medication.
Oh, I can't just break into someone's house.
Isn't that how you got into the Felkers' home?
Yeah. What?
Court records are sealed. You were 16. It was a stupid mistake. But your old gym teacher has a big mouth. Should write a thank you note.
I should thank him. Needed somebody around here with street smarts.
It's interesting to me, yeah, that like he's encouraging to go to this person's house to like investigate. So I think, I guess maybe they're taking a creative way to show how we would obtain collateral information. So, because at the end of the day, that's like paramount to making a diagnosis is what we would call collateral data. And sometimes that data is obtained through close contact. So you would call usually a relative, but only with the permission of the patient though as well. Like, so you can't just go asking about their medical history unless you have permission. You certainly don't break into their house, or probably show up to the school in which they teach. So I guess again, kind of that's the creative way of showing how they would obtain that collateral information that we do really want to know if we have access to it. So I guess we'll see how that plays out.
I should sue you.
Pretty sure you can't sue somebody for wrongful hiring.
I can sue if you fire me for not breaking into some lady's house.
Yeah, probably. Oh.
Why are you giving Adler steroids?
She's my patient.
You don't prescribe medicine based on guesses. At least we don't since Tuskegee
Sometimes.
and Mengele.
You're comparing me to a Nazi?
Oh.
Yeah, I don't think her assertion there was fair. Yeah, you will sometimes trial medications based on
other things aren't working.
Yeah. Now, the medications that you trial should not carry significant risk, though.
Yeah.
Steroids generally do not.
Nobody knows anything, huh? Then how is it you always think you're right?
I don't. I just find it hard to operate on the opposite assumption. Now, why are you so afraid of making a mistake?
Because I'm a doctor. When we make mistakes, people die.
That is true.
Yeah.
People used to have more respect for cripples, you know. They didn't really.
They didn't really.
Are you Dr. House? I thought he was a he, but...
No, don't eat too much too fast.
Thank him for me.
Right.
Oh, what's she about to have to go do? Eat her words?
It should be worth noting, though, that the steroids don't necessarily confirm diagnosis here. They confirm that there is certainly inflammation present, that inflammation has impacted her. So that, I suppose it can kind of narrow down a little bit of what your thought process is, but it doesn't actually technically diagnose yet. So we still need more data.
Should I discontinue the treatment, boss?
You got lucky.
Is he a good man?
He's a good doctor.
Can you be one without the other? Don't you have to care about people?
Oh.
He's a good motivator. He's found something else.
He's found something else.
Does he care about you?
I think so.
She's awfully interested in Dr.
I know.
House.
As Dr. House likes to say, everybody lies.
Not what people say. It's what they do. I can't see.
Seizing again.
Almost looks like a scary movie.
I know.
The way she snapped back. I mean, seizures can be pretty violent, though. Oh, this isn't good.
Oh.
Well, your chest will be sore for a while.
Okay.
We needed to shock you to get your heart going.
So she went into cardiac arrest.
All right. Well, this is interesting.
You arranged these to tell a story?
Are they testing her neurological function?
Yeah, I mean, I don't know exactly what this is, but some kind of cognitive assessment.
Could the damage have been caused by a lack of oxygen during a seizure?
I gave her the same test 5 minutes later. She did just fine. Given the latest symptoms, it's clearly growing deeper into the brainstem. Soon she won't be able to walk. She'll go blind permanently.
Do we not have an MRI yet?
How long do we have?
If it's a tumor, we're talking a month or two. If it's infectious, a few weeks. If it's vascular, that'll probably
could be less.
the fastest of all.
If it's an infection.
It's not a tumor. The steroids did something. Just don't know what.
We're just gonna watch her die?
We're gonna watch her die. Specifically, we're gonna watch how fast she's dying.
And by then, maybe there's nothing we can do about it.
There's gotta be something we can do.
It's like a spinal tap or something?
So you could, yeah. That's how you would diagnose like a meningitis.
Yeah.
Which I guess it should be worth saying, like, this doesn't look like a bacterial meningitis, because that would be like, rapid deterioration. But it, there's like forms of aseptic meningitis or something that could cause similar.
How did you find out if it was like a parasite or something?
Imaging, really.
Oh, you could find it. Okay.
Yeah.
They need that MRI.
Or you would see some in their differential, in their blood count differential, would see some abnormal. I mean, so sometimes we might see eosinophilia or something as a response to like parasite.
Okay.
But we haven't really seen any of the blood there. At least they haven't addressed any of that yet.
Yeah.
Someone someone's house, it's always better to have a white chick with you.
Besides the SED rate or whatever.
Besides the SED rate.
For all we know, she could be running a meth lab out of her basement.
He's just reciting what he was saying.
Any other reason why you think you might have chronic fatigue syndrome?
It's kind of the definition, isn't it?
Kind of the definition of getting older.
I had a couple headaches last month, mild fever. Sometimes I can't sleep and I have trouble concentrating.
Apparently not while researching this stuff on the internet.
I was thinking it also might be fibromyalgia.
Excellent diagnosis.
Is there anything for that?
Do you know, I think there just might be.
Oh, what's he going to say about this?
No.
Jelly beans or something,
I
really?
know. You've got a strong opinion on this.
Yeah.
So.
I'm not gonna waste much time on this right now, but stick around to the end because we'll jump into this. I wrote down fibromyalgia on my notes here to talk about because it's a very, very challenging diagnosis, and it's one that has a lot of strong opinions even in the medical field. Clearly, we're seeing Dr. House's opinion of fibromyalgia.
His bias.
That he's going to treat it with
Placebo.
candy or something. So yeah, kind of showing his bias, but we do see this a lot in medicine. So I think this is worth a discussion, but I don't want to take all the time now. So stay tuned for that.
Exam room 2.
House doesn't believe in pretense. Figures life's too short and too painful. So he just says what he thinks.
So they are searching her house.
Yep, they are. You could have asked her though. Maybe she would have allowed it.
Maybe.
Maybe you shouldn't have broken into someone's home.
I was 16. Don't know about ticks, but the dogs definitely got fleas.
Fleas. Yeah, I mean, ticks could be a source of infection.
Yeah.
Well, you obviously didn't grow up in my neighborhood.
Listeria? Or he's gonna make a sandwich. Oh my god.
You don't think it's kind of disgusting I get one of the top jobs in the country because I'm a delinquent? Then we'll tear up the carpet.
You don't know how old that lunch meat is.
Yeah, I know.
So you went to a better school than I did. Got better grades than I did.
She's also familiar too.
How'd you get the job? Have a guy in a bar fight?
Was she in?
That's what I'm saying. What is she from?
Was she in, oh man, what's the show? She's much older in it. The blonde, like the show about.
Oh, yes. Is it Once Upon a Time?
Yes.
Yes, that's what it is.
That's her when she was younger. Okay. Gotcha. All right.
I was like, it was starting to come.
Yeah.
Yep.
All right.
It's not a tumor. She's getting worse
Not
too
a tumor.
fast.
Arnold Schwarzenegger as Dr. House. Everyone would have a tumor.
Dr. Wilson convinced you to treat this patient under false pretenses. Adler's not his cousin. She's not Jewish.
Rachel Adler's not Jewish.
I had ham at her apartment.
To Foreman, a lot of Jews have non-Jewish relatives, and most of us don't keep kosher. You can see getting through high school without learning a thing about Jews, but medical school.
Maybe she's Jewish, but she's definitely not your cousin.
Maybe he's the new guy.
Maybe.
Rachel, her name is Rebecca.
Yes.
He's been lying?
Well, I think he's dating her.
Everything I found was in
You
my...
found ham.
So?
Where there's ham, there's pork. Where there's pork, there's neurocysticercosis.
Type 1. You think she's got a worm in her brain?
It fits.
I was right. Oh, look, he's gonna have one now.
Mr. Neurologist, what happens when you give steroids to a person who has a tapeworm?
They get a little better, and then they get worse.
Okay.
Like Rebecca Adler did.
So this would be a true zebra if it is neurocysticercosis. So we will talk about that.
In a typical case, you don't cook pork well enough, you digest live tapeworm larvae.
Oh, God.
Little hooks, they grab onto your bowel, they live, they grow up.
Well, okay, I'm sorry. Before we were, because I want to see if I can explain this right. So, because he's right. So pork is like bad pork is where we typically would consider this diagnosis, even though it's extremely rare.
Yeah.
But it does have to do with what part of the life cycle you would ingest it. So if you ingest a larvae, then you would then develop a gastrointestinal based symptom. If you ingest an egg of the larvae. And so typically when you're ingesting bad pork, you're ingesting the larvae. You're not going to develop neurocysticercosis though. It's if that's only occurs if you ingest the egg. And then the egg then like basically hatches, like forms this parasite that can then enter the bloodstream, travel to the brain.
I hope
and
nobody's
set up-
eating while watching this.
or at least not pork maybe, and then set up shop in the brain. And then what you see left behind is usually, so they actually had this in an episode of The Pit. They call it it's basically the graveyard of dead parasites in the brain form these cysts in the brain. And so now you wouldn't typically, but to ingest the egg, that's usually going to come from fecal oral transmission. So somebody who pooped out the eggs
Yeah.
and then handled food that you had. So actually, so interestingly, for her to develop this, it's unlikely that she would have eaten the pork. She would have likely had to eat something else that had the egg on it.
And you, like when he was referencing that worker with the egg sandwich, you know what I mean?
Right. So that's kind of the tie-in here. So actually, even though the pork or the ham, I guess, gave us an interesting kind of tidbit here, I don't think the answer is that she would have eaten bad pork. I think it would have just been that she ate an egg from, if it is neurocystic which maybe that's the direction we're heading here.
Yeah. Okay.
There's only one lesion and it's nowhere near her bowel.
That's because this is not a typical case.
It's an atypical.
20 to 30,000 eggs a day. They go out. Not all of them. Unlike the larvae, the egg can pass right through the walls of the bloodstream. Where does the bloodstream go?
Everywhere.
As long as it's healthy, the immune system doesn't even know it's there. The worm builds a wall, uses secretions to shut down the body's immune response. And as it dies, this parasite loses the ability to control the host's defenses. Attacks the worm, and everything starts to swell, and that is very bad for the brain.
Oh, okay.
The eosinophil count was normal.
So referencing that.
But it proves nothing.
I can prove it by treating.
No, you can't. I was just with her. She doesn't want any more treatments. She doesn't want any more experiments. Wants to go home and die.
Oh my gosh. Oh, she's going to get to meet House now.
I'm Dr. House.
It's good to meet you.
For being an idiot.
He's like,
I had to say it.
You have a tapeworm in your brain. It's not pleasant, but if we don't do anything, you'll be dead by the weekend.
Have you actually seen the worm?
When you're all better, I'll show you my diplomas.
You were sure I had vasculitis, too.
You?
I can't walk and I'm wearing a diaper. What's this treatment going to do for me?
I'm talking about a treatment. I'm talking about a cure. Because I might be wrong. You want to die.
What made you a cripple?
Had an infarction.
A heart attack?
well, she knew what that was. It's like a stroke. Oh.
Yeah, it depends where it is.
Yeah.
It's a stroke I had in my thigh muscles.
Wasn't there something they could do?
There's plenty they could do. They made the right diagnosis. Not many people get to experience muscle death.
Did you think you were dying?
I hoped I was dying.
I've never seen an infarction to a leg muscle.
Yes. Refuse to see patients because you don't like the way people look at you. You feel cheated by life, so now you're going to get even with the world. You want me to fight this. Why?
That's a good question.
What makes you think I'm so much better than you?
You're scared you'll turn into me.
I just want to die with a little dignity.
There's no such thing. You can live with dignity. We can't die with it.
I don't know that there's a treatment for this, like the cysts, like the neurocysticercosis, like the remnants of.
Yeah.
I mean, you could treat the parasite.
Maybe we can get a court order.
A court order?
Claim she doesn't have the capacity to make this decision.
She does.
But we could claim that the illness made her mentally incompetent, right?
The common result.
That didn't happen here.
He's not going to do it. She's not just a file to him anymore. He respects her.
So because you respect her, you're going to let her die.
I solved the case.
So look, I mean, I think also kind of important topic here because, you know, I don't know if anybody watching this might develop this fear that like that your doctors might be talking about you in this fashion of, well, I could just render her incompetent.
Yeah, no.
It's not it's not that simple. And no, a patient. So, but this is a challenging issue. Like you have the right to make a decision, even if that decision we deem is in the incorrect decision, right? Like, it's like you have the right to make, quote, bad decisions. We see it every day in life. Forget medicine. I mean, people make bad decisions every day. I probably made 5 of them today. It's just, well, I mean, the point is, like, we weigh risks of things and we make the decision that we feel is best. Now, there are legal situations where maybe you do not get to make those decisions for others. So we've seen this, we've seen this sometimes with, say, cases of children.
Yeah.
Parents refusing treatments for, say, curable cancers and things like that. So you'll see legal cases with that. But like a patient who has capacity, because the important term here is capacity. The patient has capacity to make their own decisions. They get to make their own decisions, regardless if that decision is deemed the wrong one by me or any of these people. So, and no, the doctor isn't going to try to, nor could they. Like, there's no pathway for them to go to what court and
Unless
say,
they just lie.
I guess.
Yeah.
But anyway, again, not saying this again, but I know it's a show, so I'm not I think some of the messages
Just in case someone
good,
had
but
fear.
Yeah, I don't want there to be like an unjustified fear out there because of some of this.
Patients always want proof. We're not making cars here. We don't give guarantees.
I think we can prove it's a worm.
Oh.
Have you ever seen a worm under an X-ray? Regular old, no contrast, 100-year-old technology X-ray. They light up like shotgun pellets. It's like on a contrast MRI.
Oh. Why are you waiting so long to say this?
Worm's cyst is the same density as the cerebrospinal fluid. We're not going to see anything in her head. He's right. We should X-ray her, but we don't X-ray her brain. We X-ray her leg. Worms love thigh muscle. Got one in her head. I guarantee you, there's one in her leg.
Okay.
Is that why she can't walk?
I don't know. This is new to me. I'm not familiar with that.
Oh, look at it.
Came to say hi.
So if it's in my leg, it's in my brain?
Are you looking for a guarantee?
There's a worm there.
Probably been there 6 to 10 years.
6 to 10 years?
Yeah, I mean, I think it can take a while.
What do we do now?
How we get you better?
I don't want to eat food anymore.
Albendazole.
So this is an antiparasitic drug.
2 pills.
Every day for at least a month with a meal.
2 pills?
Possible side effects include abdominal pain, nausea, headaches, dizziness. Probably make you keep taking the pills even if you get every one of those.
Why did you hire me? You hired a black guy because he had a juvenile record.
No, it's not a racial thing. I didn't see a black guy. I just saw a doctor with a juvenile record.
Makes it way better.
I hired you because you are extremely pretty.
Hired me to get into my pants?
I can't believe. No, I hired you because you look good. Having a nice piece of art in the lobby.
I was in the top of my class.
But not the top.
What the heck?
You think that you were hired because of some genetic gift of beauty instead of some genetic gift of intelligence?
Oh my gosh.
People use the paths that gain them the greatest rewards for the least amount of effort. That's a law of nature, and you defied it.
Oh my God.
Could have married rich, could have been a model, could have just shown up and people would have given you stuff. Lots of stuff.
Oh.
Gorgeous women do not go to medical school unless they're as damaged as they are beautiful. Were you abused by a family member?
No.
Sexually assaulted?
No.
But you are damaged, aren't you?
I really don't know how to respond.
I know. He's saying he respects her.
Well,
it took me a minute to get there.
Well, what he's saying is extremely sexist.
I know.
Misogynistic. Like, yeah, you're pretty, and yet you still decided to work hard and become something of yourself. Therefore, I respect that.
I know.
But that's like not, no. So I'm curious, like, do people generally like Dr. House? Because a very interesting approach. Here. But anyway, we'll see.
Yeah.
I followed her.
So
I couldn't stop thinking about what that doctor said.
I told you not to listen to him. He's an idiot.
I was orange.
I don't want to know what you found out.
That's the wife.
No, that's not his wife.
But I don't see how this conversation can end well for me.
Okay.
Come here because you rightly think I should fire him. But I can't, even if it costs me your money. The son of a is the best doctor we have.
Also, is he like a shareholder or something?
Maybe I can top.
He didn't have a wedding ring on anymore.
As you know, the hospital has certain rules, and as you also know, we tend to ignore them. I think this one's going to be a little obvious unless we get your help.
If anyone asks, you have 11 daughters and 5 sons.
Field trip to the hospital.
Did they get their parents' permission?
They don't need to. I mean, look, they already went to the school uninvited, unannounced.
I know.
So might as well bring the kids to the hospital.
Yeah.
Their house, but he never visited again.
He cured you. You didn't cure him.
Okay.
You said she was your cousin. Why would you lie?
Got you to take the case.
Oh.
Friend to save a stranger. You don't think that's kind of screwed up?
You've never lied to me.
I never lie.
Yeah, we do this. Because we're doctors. We make mistakes, people die.
What?
I guess it's trying to highlight that's like a cliche line.
Yeah.
Oh, it's our fibromyalgia guy.
He says he needs a refill.
Oh.
Got change for $1?
Now, I think they were highlighting that patient was probably like a hypochondriac.
Yeah.
Isn't there a different term for it now? Isn't that
Sometimes,
considered offensive?
Well, I don't know. I mean, and that's the end.
Yeah.
Just like that. You might refer to it instead of hypochondriac. You might just say like healthcare related anxiety.
Oh, okay.
All right. Anyway, episode 1 in the books. Very interesting episode.
Yes.
I do have thoughts.
Okay.
I want to hear your thoughts.
I don't know right now. I'm a little shell shocked.
Do you like Dr. House?
Okay. I cannot answer that question.
Yeah.
I just like all I know is that if he was a doctor in today's world, I don't know how old the show is. He'd get canceled right away.
We'll have to look it up and see. You know, obviously, like they're highlighting he's this sort of amazing diagnostician, but although I will say, like, I mean, I can appreciate some of the elements of medicine that the show is bringing to the table. I do think it's doing it in a more Hollywood style. Like, it's, you know, like we would have had imaging a year ago on this patient. It probably honestly wouldn't have taken quite that long to get the diagnosis. I know they had to include some drama in there with like his credentials or something being suspended or whatever, so he couldn't order tests or whatever the case may be. And this is a definite zebra. And so, you know, for those of you who I guess have been following along, watching some of the pit stuff, they've talked about this a lot. And if you've seen the show House, then I probably don't have to define to you what zebras are, but this is a very rare condition, one that I was trying to think if I've ever seen a case. There might have been like a suspected case when I was in Australia. So the backstory there, for those of you who don't know, I did spend some of my training in Australia, finished up some of that training in New Orleans, and then of course back to Cincinnati, where we are from, where I finished all that up. So anyway, very rare condition. And I kind of talked about like the life cycle there of the larva and the egg. So the other thing here that I'm not sure, and I could be wrong, because we're talking about really rare things. You know, the amount of time I've spent studying in a textbook about neurocystic sarcosis is very small. Would have been med school, frankly.
Yeah.
And so like, but my recollection would be that you do not, like, it depends on what you ingest as to what form of the disease you get. So my understanding is that you would not also then be, like, having ingested the larvae, you would not be at risk of having the egg penetrate into the blood vessel also. Like that, you would have to ingest the egg. It has to do with the duration.
Okay.
Like it's not like that egg is going to be matured in order to, quote, hatch by
So
the time you would.
if you ate the infected pork, then it would be a different result than if you ate someone's infected hands.
Yes, like if they had transmitted eggs on their hands. Yes, it would be a different result. And so that's my understanding.
Then couldn't be both.
Yeah, couldn't be both.
I mean, unless it was just rare that the ham was infected and also the person who...
Very rare.
I don't even
but
know. Hey, maybe it's happened.
Maybe. So anyway, but yeah, but I do like that they're, again, highlighting the diagnostic method, because this is sometimes a challenge. Like we do get these cases that are difficult to, quote, crack, and you do have to sort of become detective-like, which is obviously kind of what Dr. House is like. It's this sort of detective. Does seem to jump to certain conclusions very quickly.
Yeah.
Some of which
Let's try this.
some of which he's correct on, some of which he wasn't.
Yeah,
but
I like to see that it's not right all the time.
Right, and you have to accept when you have to pivot. So I do think that that's a good thing to show in medicine. I guess the only thing I wrote down, because then we talked about seizures. I thought that was a good time or a good discussion for that. The only other thing was fibromyalgia. So this is one of those diagnoses that if you ask 100 different doctors, you'll get 100 different opinions on fibromyalgia. So what fibromyalgia really kind of is, for those of you maybe ever heard it, really is sort of a chronic pain type syndrome that also tends to have issues of chronic fatigue, which is what they highlighted with this patient.
Yeah.
But there is sort of a diagnostic tool, but there's no firm diagnosis for fibromyalgia, which is why it makes it really, really challenging. It's not a blood test. It's not an imaging test. So the diagnostic criteria includes kind of what we refer to as like a trigger point test. It's where like the doctor would apply a firm kind of consistent pressure to these different, I think there's 18 of them.
Okay.
And if you get 11 out of 18 reproduce pain, then that can be diagnostic of fibromyalgia. Kind of a simple way to think of it though, and there are maps for this where you can kind of map it out, like where the trigger points are. But one of the simple ways I kind of always explain it is if you're getting consistent pain, like reproduction of pain with, say, firm palpation on, like, kind of, if you split the body in half, whether it's, you know, if you kind of draw an imaginary line down the center, pain on both sides, east and west, and then pain on both sides, north and south. So if you kind of draw that, yeah. Anyway, you know what I'm saying? Imaginary lines through, and then so getting pain in all those quadrants is a pretty strong indicator that fibromyalgia might be present. And so the reason that I kind of have this passion about fibromyalgia is because it is a very real syndrome. It is a very real diagnosis. And I think it often gets overlooked, laughed, and joked about. And Dr. House here clearly, I think what it is he sort of has this patient who brought up a diagnosis like fibromyalgia, and he's like, great. Yeah, like that's what you have. And then gave him jelly beans or something to try to fix it, because sort of counting in on the placebo effect.
Okay, well, like, what is it like for a patient who gets diagnosed with fibromyalgia that's been dealing with these symptoms for years and then gets it because there's treatment for it.
Yeah,
right?
so there are medications that actually have been proven to be effective in fibromyalgia. And so to your point, it can be, you can imagine how, patients are, they recognize that sometimes these diagnoses have been laughed and scoffed at. And so you can imagine being told you have something and you may have a preconceived notion yourself that, you may be saying like, so you're saying I'm making this up because they've been told by, in some cases, other doctors that that's the case, right? That it's a made up diagnosis. And
you're saying like when they're diagnosed with fibromyalgia, they're saying to you or whoever that this isn't made up. They now feel like you're saying that it's made up.
In some cases, yes. Yeah. In some cases, yes. And so that's sort of what we call medical gaslighting, frankly. It's kind of making somebody sort of feel bad about their diagnosis. But fibromyalgia can be really, really awful for people to live with. And the way I always kind of describe it, kind of maybe the non-medical way I would describe it, is it's sort of like all the signaling in your body that's become haywire and it's become sort of dysregulated. And then you're getting incorrect signaling to and from the brain, which is then causing this myriad of symptoms. And then this is the part then where it gets tricky though, and where some people scoff at it, is because there's no obvious reason why that signal might be misfiring.
Yeah.
And so that's why when you do testing, you don't see anything, but clearly there's this sensory input that's causing this, just without a clear source.
Okay.
Of the pain. And so, but I've seen people with phantom limb syndrome. Phantom limb syndrome would be like somebody who lost a limb in war or in combat, or lost a limb through complication of diabetes or something, and they tell you that their foot itches, right? Because they're getting a signal back to the brain that's suggesting that. Now, those are different, but I'm just highlighting how the body can send signals that don't quite make sense. And that's kind of what fibromyalgia likes to do. So this is a really tough one. And I think we do need to be a lot more empathetic and compassionate to people with fibromyalgia, because they've been told, and a lot of times they've been told, that it's sort of this made up thing.
Yeah. Isn't it common in certain, to coexist with other things?
Yeah. So you see, and I can't remember the percentages offhand, but there's like a 30 to 40% overlap with this and say other, think something like EDS, so Albendazole syndrome, which is a hypermobility syndrome. You can get POTS syndrome with this, so postural orthostatic tachycardia syndrome. This is where the heart rate can soar. It's kind of dysregulated. And then you can have passing out or fainting spells that can kind of coexist with some of this.
You did a podcast episode on POTS, right?
I did. Yeah, check it out. Yeah. So I don't appreciate how he sort of approached this guy with this maybe presumed fibromyalgia. And then of course the show tried to highlight that yes, the candy worked,
Yeah.
Well, so there is such thing as placebo though. So placebo works, they say 25% of the time. If you take something that you have a firm belief will help you, there is a chance that belief alone will actually produce hormone regulation, neurotransmitter regulation that will produce healing-like properties. And we've actually seen this. We've seen placebo work in treatment of diabetes, right? Giving somebody a medicine that had no actual effect on blood sugar, yet blood sugars improved. There is some justification for placebo, but no, it's not ethical to ever give a medication that is a known placebo. What I mean by that, giving a sugar pill or giving candy in a medicine bottle. Yeah. That would not be ethical to do.
Well, because he came in as a patient seeking treatment too. It's not like he signed up for a study.
Yeah. But sure. But in a situation where maybe a placebo is ethical, or at least not, you're allowed to do it, would be advising someone to take a vitamin or something. Even if let's say you don't have any evidence that they're deficient in said vitamin, but you say, you know what? I've seen patients improve with vitamin D supplementation in the wintertime, even if their vitamin D levels are normal.
But you're not saying that off of no basis.
No, you're not. Yeah, you're not. And you're not necessarily saying, hey, this is a cure and you're deficient, and you're not making it up. You're just saying, hey, I've seen this occur. There is some evidence that this can happen. And so consider taking this. So that would be an example where you could sort of use a sort of placebo-esque. But anyway, all right. I think that's all I got for tonight. All right. Thanks for hanging out with us, guys. Hope you enjoyed this. Let us know what you think, your thoughts, questions, and excited to jump into episode 2. So come back for that. Till next time, good night. I am Dr. Todd.